But here I'll send it or give it to Mr. Chris Schuler to go into more budget detail on the next slide.
Thank you, Kiwan. This slide here shows our original 2022 proposal for the response. A lot of things have changed since then. On the far right of this purple chart at top is the funds that were awarded, the ARPA funds awarded through Pierce County. These funds are making all the difference. The funds include $10.785 million for general COVID-19 response, 5.5 million specifically for school support, and 2.3 million that is identified for isolation and quarantine. So altogether, this batch of ARPA funding is a little over or almost $18.6 million. We do have additional funding that we are leveraging this with. This includes some FEMA funds that are available currently through March 22nd. This is the $5.4 million that will be funding vaccine clinics, vaccine education, and some of our vaccine community outreach. This is, in addition to this, for vaccine operations, is $3.1 million from Washington State Department of Health. Now, the FEMA funding, the 5.4 million, that is an estimate of the costs through March. Right now, the FEMA funding does end on April 1st. So if activities continue past that, we would be partly dependent upon the DOH funding. And when that runs out, we would not have direct funding for the vaccine clinics. Also supporting some of our isolation quarantine activities is a grant from Elevate Health of approximately $120,000. So all combined, $27.2 million of known funding so far. On the next slide, we'll break it down into some of the components and provide some estimates based upon working with our response leadership, identifying the plans and the needs for the community, and what those costs would be throughout this year. So this chart shows the response activity with an estimated cost in that second column. And in the third column is the associated funding that was listed on the previous slide. So the demand for testing and the needs for isolation quarantines, they have dramatically increased over the past few weeks. So this was not foreseen when the original 2022 proposal was developed. The original proposal also assumed that our response needs for COVID would steadily taper off through the fall of 2022. And although we hope that this is true, we will be asking for flexibility to adapt and respond to our community as our community needs change. So as we've seen with the Omicron variant, response priorities may change dramatically, especially in this case around testing. This is currently a very fast-paced and rapidly changing environment. The estimated cost of I guess that's a kind of a blue turquoise section, and that is the amount that is funded from the $10.8 million. That does have, if we proceed at that level for the year as this moment in time estimate is made, we will need approximately another $6.4 million. The lavender and purplish section down below is a combination of the FEMA and DOH funding for all costs surrounding activities around vaccine distribution, administration, education, and community engagement. And we do have approximately a $2 million deficit there. Again, if additional funding is not produced or we do not make reductions. School assistance, this is the $5.5 million awarded by Pierce County that we will be using to support schools in case and contact investigations and in testing as necessary. And then the last line in green is our isolation quarantine. This has gone up quite a bit as Omicron has further spread through the community, and community members are needing places to isolate from their families. And this is a service that is offered to Pierce County residents that may need to have a place to recover and isolate from the community and from their families. Now I'll turn it back to Key One.
And before we go to Mr. Woods, we do have a hand up from Board Member Damar.
Thank you, Mr. Chair. I'll probably have a few questions. Don't necessarily need to ask them all now, but my first one was, I don't see, with the Federal CARES Act, Pierce County got all the funding for all of Pierce County. But with the American Rescue Plan Act, we only got funding for effectively unincorporated Pierce County. Has anybody else providing ARP funding support, or have we asked others to provide in Pierce County to provide ARP funding support for this public health response, Tacoma or the other cities?
There are plans in place to make additional requests to cities that have received ARPA funding. We have not confirmed any funding yet from other cities or towns that have received ARPA.
I will just note, Mr. Executive, at least part of my purpose in convening that meeting with our cities when we first got the ARPA money was in part because of that. While it's not exactly that we only got money for the unincorporated area, it's kind of split where there's a little bit. In fact, I've tried to figure out a formula that would actually quantify it, but it's a little less, or it's a little more than that. At any rate, we have reached out to the other jurisdictions and have not gotten a positive response, I will just say. I think that we have a little firmer case now on why that would be important. And we certainly have provided a number of other services within city limits through our ARPA investments. So I think just seeing where you're going with it, I think there's an opportunity here to go back and make another ask.
Thank you, Mr. Chair. The other question is on, we are have seen at our testing sites, the demand for Omicron, fall off dramatically. I mean, I think yesterday our State Farm DuPont site had 86 people get tested, whereas, in the peak, we were doing 1,800 people at sites. Are you seeing that fall off in testing? And what are the actual numbers that we're seeing in isolation and quarantine?
Sorry about that, Executive. Trouble getting off mute. Yes, we are seeing the same thing you're seeing as well. That the testing numbers are still going down, but they're actually going down to where they were, right? I mean, the demand is obviously not going away. It's just shifting from the Omicron and completely incredible leveling down to some numbers that we would expect to see, I would say, as well. And then the second part of your question, I'm sorry, Executive, I'm going to ask you to mention that again.
No problem, Kiwan. What are the numbers we're seeing in isolation and quarantine? How many people are actually taking advantage of those services?
So thankfully last year we increased a lot of our beds, right, in anticipation of being able to flex up and down with surge. We've been seeing anywhere from about 15 up to maxing our locations out. When we were with Delta, we stayed maxed out for a great majority of that. Once Delta went away, things subsided. As we saw Omicron, things ticked back up again, and then we started to kind of get full again. We are now dropping back down again. So it follows the ebbs and flows, right, of where the cases are as far as how we expand and contract. But we are seeing those numbers start to stabilize a little bit more now that we're seeing cases go down.